More than ever, you do not have to undergo surgery to look years younger and restore a youthful lift to your face.
Dr. Alexander Cadoux from Greenspring Rejuvenation is here to talk about something called liquid facelifts. Doctor, it's great to have you back here.
Great to be back, Heather, Alex.
So liquid facelifts, if someone's never heard of what that is, describe it for us.
Liquid facelift is attained by injecting fillers to replace the volumes that we have when we're youthful. As we age, the face loses volume where we want it and we gain volume where we don't. In particular, we lose volume in the mid-face area and we get it down here in the jowl and the neck. So part of rejuvenating a face is restoring volume where it's been lost and getting rid of it where we don't want it.
And so how is it performed exactly, and what are some of the most common areas, or just do you do it everywhere?
You can do it everywhere. It depends, of course, on the particular face. So it's done by injecting dermal fillers that are extremely effective these days. They've gotten better and better and better. And the filler is bioidentical mostly, meaning it's natural to the body. So there's hardly any kind of allergic or adverse event that can occur. No skin testing is required. And depending on the severity of the aging, we inject a certain amount or volume of that filler in particular areas. So we'll also, and we'll see some pictures, we can get lifting by injecting in the upper face. If somebody has hollowness in the temples that can look sort of skeletal or skull-like, we can inject it there, and we can inject it in the chin and lips.
Here's where those laugh lines come into play.
That's right.
I mean, that's what we have in our family. It seems like we get those the most, especially as we get older, and you just plump it up, and all of a sudden, yeah, it's like 15 years younger.
That's right. And this lady here on the left, you see, she's lost volume in her cheek. It's caused her face to fall, and it's given her the appearance of jowling. She's also lost volume in her chin. So when I treated her, I restored volume and resculpted her cheek and her chin, and in resculpting, it has lifted the jowl, and she looks arguably 10 to 20 years younger. And this is all in a lunchtime procedure.
Yeah, it's amazing.
Right, I mean, we're in the age when we're taking pictures all the time. Imagine if your profile was improved and you didn't have those jowls. And here's another dramatic difference result.
That's right. This is a woman who's lost a lot of volume under her eyes, and it gave her that hollowed out, baggy eye look, and also a lot of volume in her cheek. Now, in this lady, I did not restore the volume in the lower face. But you see, just by restoring the volume in the cheek area, look how much it's lifted the lower face. It's resuspended or rescaffolded, and it's given her a facelift without surgery.
You know, we've always thought that you need to do the pullback in order to look younger, but you don't. So how many treatments would you say somebody needs?
Well, that woman, for example, had 2 treatments. It depends on how much you want to do. Some people come in, they say, I have an event, let's get it all over with. We may do a fair amount of filler in one session. Other people say, oh, I don't want anybody to notice, I want to go gradually, or I can't afford to do it all at once, let's go gradually. In that case, we may do 1 syringe a month, and over the course of 6 months to a year, the person looks 10, 20 years younger and still looks like themselves. You know, they don't have that windblown, strange look that some people get with a facelift.
The windblown look, that's exactly right.
It really is an investment in yourself. And you know, you're talking about, say you have an event to go to. How long before that event should somebody do this? Imagine not the day before.
Right. No, don't do that. There's always the chance of a bruise with this. There's no downtime except you may get bruised. And in that case, you don't want to go to your event with bruising. There also may be some swelling as well. But but you can go back to work. I mean, if you can cover up a bruise with makeup, then you can go right back to work, do it during a lunchtime. For people that get significant bruisings that you can't adequately cover with makeup, we offer free laser treatments that reduce the bruises very promptly.
Who would you say the perfect candidate would be for this?
Well, you know, anybody can do it as a part of grooming. It's becoming a grooming item, also to some degree a fashion item. Anyone can do it. We get younger people who want very large, fashionable lips that may not look natural, but their intent is not to have it look natural. It's a fashion statement to have very, very full lips. Older individuals tend to want to look like they used to look. They don't want to look like they've been treated. So it depends on the person's agenda. But it's better to start early and build over time. There's no need to do too much at once. With this procedure, unlike a facelift, you don't go under anesthesia and hope you like what you get when you
Right.
wake up. You can go very gradually and participate in your end result by telling the physician, in this case me, what it is that you enjoy and what you want to accentuate, and when you're done, filling a certain area.
Well, not only do you have a great expertise, but you make people feel comfortable at the
Totally.
same time. Doctor, thank you so much.
It's a pleasure.
For
Great to
more
see you.
information, the procedures done by Dr. Cadoux, you can check out their Greenspring Medical Aesthetics locations. They have 2 of them. You can also call them at 520-529-9665 or visit greenspringaesthetics.com.
You're watching The Morning Blend. We'll be right back.